is in comparison with the DEXA. We have done this study because the quantitative ultrasonometry is a technique for the investigation of the density of the bone and that measure the ultrasound velocity and for interpretation of the trabecular and the internal layer of the bone. We have two piezoelectric crystal to pass the wave, the ultrasound wave, and we measure that, and we know what kind of bone we have in the patients. I put here a correlation between the histological in normal bone and the wave, ultrasound wave, and the histological in osteoporotic bone and ultrasound wave. These two measurements are ADISOS and VTT that are only the first most important two parameters that we use and we put in comparison with the DEXA. The cause is different because we have no radiation exposure, we have a small size and important for the portability, the low cost, and the reference data under 3 years old. And we have a good compliance because it's very simple to do. This previous study are the only two studies in the literature. We have, but these two studies is on a very small group of patients, no more than 10, I think, I remember. This study is our study. We put the inclusion and exclusion criteria. In the inclusion, we have the age from 0 to 18 and the diagnosis of osteogenesis with radiological, clinical, and genetics diagnosis. And in the exclusion criteria, we put inside the bisphosphonate or other medicine, the treatment of the patients in the last 2 years, and the disease that can interfere with bone metabolism as gastrointestinal, cardiovascular, and so on. In the first year of the study, we have 34 patients, an age with a media of 4 years old, and we have this data of BMD in absolute value, ADISOS and VTT. We have done a hair correlation, a regression line to ADISOS and BMD, and VTT and BMD in these 34 patients, and we have a very high correlation. But in the second year of the study, we enrolled many other patients. We arrived at 60 patients, and we divided it in the type 1 and type 3-4, and I put the P for this student for the BMD because you can see the difference between type 1 and type 3 of 3 and 4 BMD. The correlation, in the total correlation as the first year in the 60 patients are similar to the first year of study, but we have this data of mild form and severe form that are very are different, not from here, but for BTT and BMD, because the severe form are very high correlated, and not as the mild form. In conclusion, this study suggests that CUS, DS, and BTT are correlated with bone density and cortical area, and these parameters are in accordance with the previous study in the literature. We found that ADISOS and VTT values show a high correlation with BMD of DEXA in patients with severe form than in patients with mild one. And our data suggests that CUS effectiveness to evaluate bone mineral density in patients with osteogenesis imperfecta has a lumbar DEXA. In further study, we want to enroll many other patients, and we want to do a follow-up, and we want to see if there is a change in patients that are treated with bisphosphonate. And in the third year of this study, we want to do a ROC curve to correlate with a healthy group, and we want to know if it's very important in the bone analysis in the patients with HOI. Thank you very much.
Senso mettere insieme le 3 e le 4 in questo studio, mettere insieme le 3 e le 4 non ha ancora ha senso, non sono diversi.
Il problema di fondo è che gli esami che abbiamo anche noi, che confrontano